Well, let's talk about masks. And we've reported LA County Health now recommends everyone, even if you're vaccinated, to mask up. This is all because of that new Delta variant.
Yeah, they're talking about in public places. So let's bring in clinical nurse specialist Alice Benjamin now. What's your take on all of this, Nurse Alice?
I think we're being prudent. We're being safe. With the Delta strain, it has been shown to be the most fittest, the fastest, and the most virulent strain of all of the COVID variants that are out there. And I think we need to proceed with some caution because we are seeing people still getting sick. In fact, here in Los Angeles County, our test positivity rate has increased. We are seeing a slight bump in the number of people who are in the hospital. So I think it's prudent of us to look at this information and move cautiously, because we're heading into the summer. People are going to be out. The mask mandates have been lifted, but we need to proceed with caution.
All right, Nurse Alice, the state just lifted all restrictions and recommended we take the masks off if you're vaccinated here. So is it too little too late?
It's not. It's never too late, actually. So we know the CDC made an announcement last month. These were some guidelines. It came to our state, and then we lifted the mandate. However, what we're recommending right now is it's a strong recommendation. So it's not a requirement per se, but it's recommendation because we're seeing, again, an increase in our positivity rates. This Delta virus is showing to be more contagious, actually more serious, and provide for severe illness. And so we want to prevent that. And without going back to, locking things down, instilling capacity limitations, requiring social distancing, the easiest and simplest thing that we can do is wear a mask. And frankly, we've been wearing a mask for so long, and many of us are still continuing to wear them, even though the mask mandate was lifted.
Michael and I talked about this. When you go to the grocery store, it seems more likely that everyone has a mask on rather than off, even if you've been vaccinated. And that would be one of the public settings that this recommendation would apply to, would it not?
Exactly. And if we take a good look at the CDC guidelines, what they recommended is that masks can come off for vaccinated people, except in certain situations. So, for example, when you travel, trains, planes, automobiles, you still needed to wear a mask. When you're going to indoor schools with young children, you still need to wear a mask. So it's kind of the same thing. You're going into a populated area where the vaccine status of those around you is unknown. So we want you to protect yourself because although someone who's vaccinated is very unlikely to get severely ill or die from coronavirus, this Delta strain, you still can be part of the transmission strain. And the way to prevent that is to increase the number of people who are vaccinated, because the more opportunities there is for the virus to spread, the more it can mutate. So we have Delta strain right now. There's going to be possibly a Delta plus or even a more virulent strain if we don't take these precautions now.
Nurse Alice, it's important to point out we're talking about a slight uptick in hospitalizations and cases. So when we talk about the Delta variant here, if someone gets this strain, what are the symptoms and give me the range of illness here?
So the interesting thing is when someone comes to the hospital, we test them for coronavirus, SARS-CoV-2, and it's a positive or negative. To determine what strain someone has requires some genomic testing, and that's randomly done by the county. So we're not necessarily doing that in the hospital to know exactly which strain you have. So it's important for the public to know that. So you will still present with the same symptoms as coronavirus: shortness of breath, possible chest pain, fever, chills, body aches, severe just fatigue. So it's some of the still vague general symptoms. So, coronavirus, it's all still of the same family. Where our biggest concern right now is this Delta strain, because again, it replicates the fastest. It overwhelms our body, so it makes it easier to invade and overcome our immune system. And so our concern is that if this is not stopped now, it may find a way to work around the current vaccines that we have. And right now, our vaccines are working. They're working against the Delta strain of those vaccinated, but we got to get to those unvaccinated people, Michael.
All right. Nurse Alice, as always, we appreciate your insight. Thanks for being with us.
Thanks for having me.
And knew it for a high school senior in Huntington Beach, honored with a scholarship in memory of standout athlete CHRISTINA MAUSER.